here talking more liposuction, more fat transfer, BBLs, and more importantly, how are you going to get rid of that front of your belly? That's what we're talking about today. We got this special going on right now, particularly aimed towards those individuals who have that big hanging belly in the front that's restricting you, that's embarrassing you, that you keep covering up with your pants. I know this stuff's limiting. I've been dealing with these patients for 15 years now, and we've developed techniques to significantly reduce these and eliminate these folds. You see these pictures up here, and we're going to show many more of these throughout this, so stay tuned. These people are able to change their lives so quickly. And I can tell you the people that do the best are the ones that are ready to change and transform their lives today. And this is just one step in their process. So if you guys have any questions, we're talking about liposuction, fat transfer, how to get rid of that belly without a tummy tuck. Okay. Sorry, just a little technical stuff here. We've had quite a few individuals who have made the mistake of going to doctors elsewhere, and these ones were just close to their house. There was an individual from Kansas City, there was one from New York City, Manhattan area, and there was one from San Diego, and these were all in the last week or two, individuals who went elsewhere to get their liposuction and are now seeking for assistance because they simply just didn't take out enough fat. And these are large individuals, just like the people that we are able to help. They're large individuals that went elsewhere and they tried to do 360 lipo on a large patient, and all three of these individuals were stopped after 5 liters were removed and not when the procedure was done. And so all of them were left disappointed with more fat left behind, and they were told, "I'm sorry, we hit our maximum and we couldn't do any more." And that was all despite them paying already for this procedure. So to me, this is total crap, and I can't believe that there's professionals out there that would do this to individuals, and it sucks because redoing these procedures a second time is it's not the thing that you want to do. Not for me or not for you either. It's difficult for the patients. It's difficult for the providers. So revision liposuction should not be a thing. My philosophy is to get everything out the first time so you never have to go back in that area again. So ideally, you'll never have to get liposuction in the areas that we treat ever again. Now, with that said, I've done thousands of these procedures, and over the years, there are a few people that do end up gaining weight, not living the healthy lifestyle, and they request additional liposuction in the areas that we treated. And it's usually 4 or 5 years later. But it's people like that really solidified with me the importance of changing your lifestyle. Because I can tell you that the people that get the good results, it's the same story. And all you have to do is just follow the story. And so that's why we've done these journeys for you on our website. You can check this out. On our website, there's pages. Instead of before and after photos like everyone else does, we decided to tell the whole story of the individuals and give quotes and give testimonials, videos, audio, pictures, and really tell their story, because when you start to understand their story, you see what their struggle was and how they overcame it. And then since they are public individuals, you can go on Facebook or Instagram now and follow them and connect with them directly and see, get the truth, get the real information. What's up, James, Jesse, Maid Gonzalez, Tina Marie, Yoslin, Felicia. Welcome, everyone. So, and last week we had actually one of these individuals had come in, and this individual was from Chicago, and she had gotten liposuction, 360 lipo. She was, I want to say 5'6", she's about 240 pounds. She's a big girl. Belly was hanging over. and she was very, very full still. However, just 6 months prior, she had had 360 liposuction at a clinic in Chicago. They took out 5 liters, and uh, she said she didn't notice any difference. So this is where some of the reasons why I changed my philosophy. So instead of trying to on larger individuals like this, instead of trying to do more than we should, I decided let's isolate and focus particularly on one area and maximize the amount of fat we get out of that one area so we can get the results that we want. So that's where these big bellies, we treat only the front of the abdomen and get as much out as we can. We do an awesome job, very aggressive. We get a lot of fat out, and in many cases, this fold is going away completely. Even on these large individuals where the belly's hanging all the way over, you can't even see their underwear. The belly's going away. It's amazing. Really cool story we just had earlier this week. A young lady, she was, I want to say she was young. She was probably about 26, 27. And she heard my calling. She heard my calling on these Facebook lives. She heard me calling her, and I was speaking to her, as she said, and that she was the exact person that I had been describing. She was a larger individual. She had that big hanging belly. This is a big girl, and she had struggled. She had struggled with confidence. She had struggled with the limitations that having this big mound of fat in front of you, stops you from bending and moving and going up and down stairs, and limiting your energy. That was her, and I was speaking to her, and she said she jumped off the couch and just made a decision that this is what she has to do, and she was ready to change her life. And she came in and she acted quickly. And within a week, she had gotten her consultation, placed her deposit, and flew out here to get the procedure. And we got her amazing results, amazing. And so that's how quickly things can happen for you if you want. See, when people aren't ready to change, it's no fun working with them. It is no fun at all. The people that think that this is a shortcut and you're just going to, pay whatever you pay and then magic happens for you just because you spent the money, that's total bullshit way of thinking. So don't bring that to us. Like, you're not going to do well, and it's not going to be good with anyone. So you got to change your mindset and your mentality and get realistic. This is a serious thing that we're offering here. Liposuction, it can make a huge dramatic change for you, but it's a journey. It's not an overnight thing. It's not just get the procedure and game over. It doesn't work like that. There's a recovery involved. There's risks involved. And not only that, afterwards, it's so important that you change your lifestyle and live the way a healthy person should live. Many of us, we live an unhealthy lifestyle for so long that it leads to these unhealthy things. It leads to overweight, obesity. It leads to high cholesterol. It leads to high blood pressure, diabetes, heart disease. These are all things that are common in their lifestyle choices. And that's the thing that we're not really told. We're not told that all these problems that we're developing in our 40s and 50s, we're not told that those were all because of the bullshit that we did back in the days. Some of you guys are getting wise on this, and you're opening your eyes and you're realizing that it was the habits that you've been doing, the eating unhealthy food, and you know what it is. You just like it, and that's the problem. Is that like is so much that you're willing to give up your health for it, and so there comes a time when the health becomes more important than this other stuff. There's a good story with Bill Clinton. Bill Clinton, he became a vegetarian, and he was clearly known in the past for being a big meat and potatoes type guy. Steak was his main thing. Everybody knew it, and he stopped eating steak and became a vegetarian. And so the newscaster asked him, what's the deal? I know I've known you for years, and you were always a steak and potato guy, and what happened? And he said, well, I chose to live. Well, as it turns out, Mr. Clinton, President Clinton, had a heart attack, and it was required quadruple bypass surgery, I believe it was, so heart surgery. And afterwards, he decided that he wanted to live a lot longer. So he decided to change his diet, and he changed everything. And he started eating vegetarian and learned to be a healthy person. And he waited, and that was well into his 60s. So you should not wait that long. The earlier you can make this choice, that you realize that it's the actions that you're taking today that are affecting your life, the quicker you can realize that and start changing your life, it's like a domino. It starts affecting everything going forward. So the things that you can do today will affect the rest of your life. And it can impact, I was explaining this today, that if you can think of every little thing that you do in your life as a positive or a negative, it's a plus or a minus. Everything that you put in your mouth is either a plus or a minus. It's either helping you or hurting you. And if you can see things in these positive and negatives, then you can start. If you can imagine, then starting to stack up the positives. You just got to get more positives. And I don't know what the right ratio is for you, but I can tell you this: it only takes one bad thing to kill us, right? I mean, you jump off a cliff and you're done. It's one bad decision. Now, most of us will make bad decisions on a daily basis, and we do it consciously, we do it knowingly, we do it willingly, and we will do things that consciously we already know we're hurting ourselves. People that are smoking cigarettes still, that it's going to kill you. It's just a matter of time. It's just a matter of time. So it's the consciousness that you need to wake up and realize what's going on in your life and where do you want to be. Sometimes what happens, I think, that we get so far behind the 8 ball and things are so difficult in our life, at some point you start to give up. And you start to, say it's not worth it, or it's just the way it is, and I'm just big boned, or, I've tried and I'm not able to do it, or I'm too tired, or, whatever your excuses are, they're just excuses. Because there's literally millions of people that have, it's the same stories. Not with us with the liposuction. I'm talking like millions of people that have changed their life around, transformed everything, and you got these before and after pictures. And to be honest with you, I did it myself. I thought it was fun. I wanted to prove that it was possible for me. So I had gained weight. I'd got up to about 220, 225, something like that. And I decided, I remember there was one specific day I decided, all right, I'm changing, and this is it. And I wrote out all the things I wrote on paper and committed to what I was going to do and what my goals were and what I wanted to achieve and why I wanted to achieve them. And after I wrote it out, it's like everything changed in me. And I had goals to reach, and I had and I had a plan. And that was the important thing, is I had a plan. So you can do this too. And clearly it's possible for anybody. I mean, when millions of people are able to do this, it's possible for anybody. It's just a matter of what are you willing to do to achieve your goals. And sometimes for some people it's going to be way more difficult than other people, and that's just your path. And nobody can make it different for you. Some people's paths, they're just wrought with like bumps and difficult stuff. But I'll tell you what, whatever doesn't kill you makes you stronger. And although things may be challenging for some of you, it's the struggle that makes us wise. The wisdom is found in the experience. And all of the problems that you overcome are then the tools that you have to use for tomorrow. So working hard is something that is so undervalued in our society. People are trying so hard to not work hard. But I think that's the exact opposite, because the harder you work, the more you learn. The more you learn, the smarter you get. The smarter you get, the better your life is. When people are intelligent, they're able to make better decisions. And you get your intelligence from reading and being around smart people, but it's also experience. I know lots of people that are street smart, and they're smart as hell. And the funny thing is they learn the lessons in the street that other people learn in the books. And to be honest with you, I think that the street smart is probably more intelligent, it's more creative than the book smart. Book smart people, I know I'm a little bit of both. I can't say I grew up in the hood and that kind of street smart, but okay, how is the pain level? So pain is perceived differently from everyone. And if you want to talk to the people that pain is a problem for those people, you're going to hear a totally different story than the people that have a handle on and can control pain in the way they perceive it. It's really, really interesting because I've done this procedure for so long, and there's such a wide range of how people perceive the sensations that they experience with liposuction. And here's the truth: I don't know what you feel, you don't know what I feel, and there's no way words can even portray the actual sensation that we feel, because that's impossible. Okay, so when you hear people putting into words that it was so painful, you don't really know what that means. And if you allow those words to scare you, and to scare you to the point where you don't get the procedure, then that sucks for you, because now you're not going to get the benefits that this procedure can give you. So that fear will stop some of you. And maybe this just isn't for you. You know, there are options of general anesthesia where you can do this, where you put to sleep. In my opinion, it's not as safe and it's more expensive. So, you know, you need to make the choices. This is not for everybody, but the people that go through it, we can get these amazing results. One of the advantages of being awake during these procedures is you're able to move for us. And when you move for us, you can get into the perfect position for me to do the best job ever. But when you're asleep in general anesthesia, it's really difficult to move the patients when they're asleep. It's, you know, no pun intended, but they're dead weight. You're trying to move them and they can't help. It's really, really difficult. So because of that, most of the doctors that do procedures under general anesthesia, the results are mediocre. And it's just about getting out a volume of fat. It's not about perfection, like what we're trying to attain. Okay, while the procedure, do you add numbing cream? We use the lidocaine, which is an injectable medication for the numbing. And, you know, here's the thing is, you know, it's the same lidocaine for everyone. Everybody gets the same lidocaine. If it hurts, we add more, of course, but it's the same lidocaine. So, you know, why does it work on one person and not on another? I don't have those answers. And why does one person require more medication than another person? I don't have those answers. It is. So we just, you know, we have our, you know, say tools at hand, and, you know, we do these procedures, and it's the same. Look, we do the same techniques as everyone else as far as the numbing medication. So it's not like we're doing, you know, something crazy here. One of the things that we don't do different, I don't like to do, is I don't like to heavily sedate with narcotics, because you end up getting people get nauseous and they're lightheaded and dizzy. They fall afterwards. Lots and lots of complications with the narcotics. And I'm sure if you guys do any Google searches, you can go find there's lots of problems with the narcotics and the anti-anxiety medications. So I prefer not to use them, but we have them available if you want them. You know, I'm hoping that I'll attract people that are not looking to get doped up for their procedure. Okay. Constanza says, you told your hubby that you want to have the procedure done. Awesome. He's gonna thank us. I've had quite a few husbands that have thanked us recently, which is always cool to hear. You know, when they finally, their wife has a butt, it's like they're like, yeah. And men do get this procedure as well. So, you know, a lot of you women, I know that you're getting these procedures, but you know, if your husband's anything, you know, have any issues with their belly, we can help them out as well. So, what's up, Rebecca? If you guys don't know Rebecca, she is one of our previous patients. She's also the moderator on the Facebook group. So if you haven't joined the Facebook group yet, make sure you jump on there. You can follow many of our previous patients. A lot of these pictures that you're seeing up behind me, the people are posting them on the group, so you'll be able to connect with those individuals directly. Do you work on people before or after bariatric surgery? Yes, before and after. It just depends. You know, everybody has their choice. I'm honestly, I'm not a fan of bariatric surgery. Although I'm sure it has its place, and you know, it's just it's everybody's journey is a little bit different because of their choices. So, you know, the bariatric procedures are good, but from my understanding, there's a lot of restrictions, like dietary restrictions after the procedure. And if imagine on what they actually do with these bariatric procedures is they're literally like, instead of our belly, being a certain size, they clamp it off to make the stomach actually smaller. So the space that your stomach works in and does this digestive thing is smaller, so it pushes the food through quicker, which means that you don't digest it as well, and these people end up having issues with um, like vitamin deficiencies, because they're simply not digesting the food properly and absorbing it, so that you have issues. And then for the rest of your life, you have to take supplements, and you have to be concerned about malnutrition type stuff. So that's the big reason why I don't like it. I know there's lots of patients that get it and they like it and it works well for them. So again, make your decision. You got to do what makes sense to you. How the difference between liposuction and bariatric, it's totally different. Bariatric is it's like a calorie restriction, so the fat cells will shrink up. When you lose a dramatic amount of weight with bariatric surgery, the skin doesn't have the same elastic nature when you do liposuction. So when you do liposuction, the procedure itself causes the skin to tighten. It's the trauma of what we're doing, the procedure, and removing the fat. It traumatizes the skin, which causes the healing response. And the healing response leads to the tightening of the skin, which is why when these bellies go away, the skin fold goes away as well. With bariatric procedures, I don't think you're going to get the same type of result. It's different. The skin tends to sag. You don't get that rebound. So that's the choice. I've also, with patients that lose like 100 pounds plus and then try to get liposuction after that, it's really, really difficult. I'm sure there's some balance. The people that lose 100 pounds, what happens is they end up having a lot of fibrous connective tissue that kind of holds onto the fat, so it makes it difficult to remove the fat. And once the skin kind of sags like that after the procedure, it's I don't know, somehow it loses that elasticity. I'm not exactly sure what's happening, but I can tell you just from experience and my wisdom that it's not a good thing. Many of those people end up getting the skin cut away because they have that loose hanging sac. So I would suggest that there's got to be some balance of where you don't lose an excessive amount, but losing some would get us to the point where we can remove the fat safely and easily, and then you can continue with the weight loss of the bariatric surgery. Are the holes small? So the incision points that we make for our entry points for the instruments, they're 2 millimeters. They're tiny, about the size of the tip of an ink pen. So they're very small. Now, with the procedure, the instrumentation going in and out, you have traumatizing of those holes. So sometimes they get stretched out, so they may be quite a bit larger after the procedure. Someone's asking about paying, costs of these things. We've had a lot of pictures behind me, so I'm not sure which one you're talking about. If you're serious about getting the procedure, the only way you're going to get pricing is by getting a consultation. We have to see pictures of you. I'm not going to tell you what any of these people paid. It's none of your business really, but it's everybody's different. And every situation is different. We take these things into account. You'll see these people, like the front of their belly is not the same for everyone. And this is a lot of work. It's a lot of work, and this is the reason why a lot of you larger individuals are getting turned away from elsewhere, because it's not easy to handle these situations. I just figured out how to do it, and I've gotten really good at it. And it's I've made it easier for myself and for my staff because we've done it so much. But it's different when you have larger people, because the complications are a little bit higher. It's more traumatizing to the body. The recovery is a little bit more challenging. They have more swelling, more bruising, more drainage of the fluid. It's not as easy. And I know a lot of doctors just turn them away, and they create these artificial BMI restrictions and saying, oh, if you're over this amount, we can't do a procedure on you. Honestly, I think The only reason they do that is just to make it easy for them to say no, they don't want to work that hard. I mean, that's just what I think. But you look at like pictures like this is phenomenal. She's clearly one of those individuals who, if you would have gone to any plastic surgeon on this planet, they would have told her that she needed a tummy tuck, and that's the only thing that they would offer to a person like her. They wouldn't do liposuction, so she got turned down all over the place because her BMI was too high. And yet, look at the results. We only treated the front of her abdomen. So you can see how well that fold of skin just disappears. It's quite incredible what's possible with these procedures. Okay, do you perform work on patients with diabetes or high blood pressure? Absolutely, Carly Vet. Most of these patients that you see, these larger individuals, that's the problems that they have. I mean, that's like par for the course. It's a little golfing. Maybe you guys didn't get that, but it is what it is. I mean, when you get larger like that, almost everybody has high blood pressure. Almost everybody is pre-diabetic or diabetic. Most of them have high cholesterol. They're unhealthy, and here's the key though, is you have to want to get healthy. So if you're unhealthy now and you don't want to get healthy, you just want to lose weight, or you just want to have less of a belly or whatever, you want to look good, that's your why, you're not going to be successful with these type of procedures. So the people that get that believe that, and are thinking down that line of thinking, they end up getting these procedures, but it's never good enough for them, so they end up getting another one, and it's not good enough, so they get another one and another one and another one, and they end up blowing like their whole life savings on these procedures. So my opinion, just my opinion, get it done once, get it done right, and live a healthy lifestyle and live a good life. I mean, it's all about just living your best life. If you can choose today that you want to start living your best life, then you'll start improving one day after another. And it's not like you have to do everything all at once. So don't think that you have to lose 20 pounds in a certain time period. It doesn't matter. It doesn't matter how quickly you do it or how slowly you do it. It's just a matter of that you need to start going in the right direction. Right? Imagine like you're steering this ship, this big gigantic ship, and you don't have to get everything perfect. You just need to go point in the right direction and start going down that path. And get off the old path. You have to stop doing the things that you were used to doing that cause the problems. And that's the biggest part, is just you have to stop causing problems.
Got a question on YouTube, Trevor.
Okay, let's see.
I'm ready for you.
All right. Okay, I know you get this question a lot, but I'm concerned about hanging skin, specifically the upper arms. And perfect, there's Granville. So hanging skin is a common problem with this procedure, and that people are concerned about. And this is where the solution that the plastic surgeons have come up with is to cut away the skin. And so whatever they perceive as extra skin, they just cut away, and then now you have a huge scar. Like on the arm, they go from elbow to shoulder, and they'll cut back here. Now every time you look back here, you have a scar all the way down. It's clearly visible, and they're ugly. They're really ugly. I've never seen a good arm scar. They're huge. They're fat. They always get wide. Every girl that I've seen that has this, not every girl, but a lot of them end up getting tattoos to cover it up, as they do with the tummy tuck scar as well. So this is only liposuction, and this is an extreme example, I think, to prove a point. This individual, obviously she was fairly large. You can see at the elbow the angle at which that fat hangs, that elbow, that back of the arm. And you can see on me, clearly straight across, and on her, it comes down, right? So it's hanging all the way. It's at probably, what's that, like a 60, 70 degree angle, if my math is right. It's a big deal, and it's hanging down. So one would think that if you remove the fat out of there, she would just have a sack of hanging skin, right? It would just hang down. Well, in fact, that's not what happened. And this is the point that I've been trying to make, that this happens on every part of your body. It doesn't matter whether we're talking about the abdomen, the thighs, the the arms, the chin. It happens everywhere. The skin retracts and tightens up, always. And even in these extreme cases like this, where you would anticipate loose, hanging skin, it retracts back amazingly. Now, I know you can't see how up close on this, but the skin has, there's, what's the word I'm looking for? Kind of the skin itself, as it contracts up, it has a weird look to it. It's I guess people have described it as crepey. So some of you who are, I know I'm in my 40s now, and you see like that on like the back of your hand, that how the skin gets kind of wrinkled, and people will start noticing that in the neck, and it gets thin and loose. That happens on the back of the arm, and then when we take out large volumes of fat, that stuff retracts back, but it's not like it's not the same as skin that was never damaged. So when you have damaged skin, it's going to look like damaged skin that tightened up. So it's not, shall we say, perfect or normal per se, as if she never had huge arms like that, but it's way better. And more importantly, through clothes, she can buy clothes that fit over her arms. Like, that's huge for these women to have big arms, huge. So the ability to wear clothes that fit now, it changes your life forever. And now she's able to do things differently. She acts differently. She goes places and shows off her arms. And it's amazing. You see here that bra fat. It's another thing when we do the arms, we like to get rid of that as well. Okay. How do you heal the wounds? I don't heal the wounds. Your body heals the wounds, and nobody knows exactly how that happens. They have theories on it, and they'll do models and stuff and show you how your body heals, but nobody knows. We have this amazing technology called the human body. It does incredible things all the time, and it does it without us having any knowledge. Like, you don't have to be like, okay, I want to heal that wound. No, you don't have to. All you have to do is just be. Just be alive, and your body's going to heal. Now, the things that you can do to aid the body, your body needs the nutrients in order to, it's kind of like the building blocks. So having a good vitamin is going to give you the building blocks to help heal. What I've found is a lot of our larger individuals are having a higher rate of infection, which I'm postulating or I'm guessing that the problem is that their health is such that their body's just having a hard time healing these wounds. And when they have a hard time healing the wounds, you have open wounds for a longer period of time. And then you have more exposure to bacteria. Infections can always happen anytime you have an open wound anywhere. I mean, you could have a scratch on your leg and it could get infected today, and you're not even having any surgery. So infections happen when there's an open wound. So now after liposuction, you have a bunch of open wounds. So it's potential. It's always there. We know it's always there. So we give you antibiotics to reduce the chance of infection. Now, the things that the patients can do is to judiciously keeping everything clean and dry as much as you can will help reduce the potential for infection. The people that tend to get it, there's not always a reason. Nobody knows for sure. But the people that might have more issues with rubbing or irritation of the wounds or sweating, if it's in a warm environment, these could all lead to more infection. So the answer is, like, nobody heals your wounds. You heal the wounds, but it's not about that we absolutely have to do anything. Your body's going to do what it does, but you have to create the environment that is right for the body. So again, keeping it clean, keeping it dry, taking a multivitamin. And there's other creams, there's other techniques. If you go through wound care type stuff, they have lots of recommendations, but just be prepared. You're getting yourself into a procedure where all these things are possible. So it's the knowledge is power. So know what's possible, know what to do in case shit happens. And that's the key. And the thing is, you don't have to know everything, because you're going to get my cell phone number. You're going to get Kale's number. We're going to connect with you. And any questions or concerns, you can always call somebody. You can always get answers. Wow, she's having a conversation, but I'm not really following her. She's concerned because she's heavy. It's somewhat comforting knowing it's an option. Okay. Jennifer says, I hear a lot about micro air lipo. What's the difference between that and laser lipo? So micro air is the brand of liposuction instrumentation that I prefer. So micro air is the hand piece that attaches to the cannula that we're going. And so it's also called power assist lipo. The technology with micro air is a pistoning type technology, so the instrumentation is going back, so it's moving back and forth. It's a high reciprocation, about 5,000 RPMs per minute. So that's how we break up the fat and remove it. The difference between micro air and smart lipo or the laser lipo. So smart lipo is a brand. It's kind of deceptive because it's not actually lipo. Smart lipo is a brand name, just like Coca-Cola is a brand name. The brand name is for a laser, and laser is this this technology that we pass underneath the skin, and it's used in conjunction with the liposuction. So that's, I guess, why they call it smart lipo, but it's just a laser, and the laser heats up the inner surface of the skin, causing a contraction. And it's been shown through studies that it stimulates collagen growth for about 6 months after the procedure, so you'll continue to get thicker and tighter skin with a maximum benefit about 6 months out. There's many other benefits though. We will typically talk about the benefits of the tightness of the skin. However, there's also the coagulation of the blood vessels and the tissue, which tightens everything up and helps for a quicker, shorter recovery. Do we do breast lifts? We do not do breast lifts. However, we do liposuction of the breasts to remove volume of fat. This is very beneficial for those women who have like shoulder pain, back pain from those pendulous breasts. It's funny you asked that because I literally just did one of these today, and we got about 1.5 liters of fat off of her breasts. So that's quite a bit of weight, and when you consider. Now, my experience with breast reductions through liposuction is they will typically maintain the same visual shape and look to them. However, the volume will be reduced. And so they'll flatten out from, like if they're sticking out here, they'll flatten back to here. And if they're hanging down here, they'll bounce back a little bit. And the reason why they bounce back a little bit is not because we're doing any cutting or any of that stuff. It's because it's simple physics. When you remove a volume, when you remove a weight, the weight is pulling down. So when you reduce the weight, it bounces back up because our skin has elasticity. In addition, we also would use the Smart Lipo laser to tighten up the skin, and it gives you some of that elasticity back. Now, it's not the same as the breast reduction. The breast reduction that the plastic surgeons are talking about, first of all, I'm just going to preempt and say I don't like that procedure. Again, I don't really like the big scars. And the other problem, because I see a lot of women that get this, I don't like that the shape that is created of the breast post reduction, they rarely will ever have a natural shape to them. And if you think about it, it makes sense. It's almost impossible to cut away a big portion of the breast and then recreate by pulling the skin together and sewing it up, then recreate to a natural looking shape. Humans just aren't that good. So we aren't the creator. We aren't the one that created these bodies. Humans typically aren't that good to recreate the shape and make it perfect. It's damn near impossible. Now, what a lot of them have done is, in order to get a perfect shape that they're looking for, they'll put an implant in there. So they'll lop off a big portion of your breast. They cut a circle around the nipple, so now you get this weird looking nipple that's perfectly symmetric. And there's a scar around it, but then they put an implant in there, then they wrap the skin around it and tie everything together. I don't like that procedure. It's a lot of people get it, and it might be right for you. But if I could avoid it, I would try and avoid it. And liposuction is an alternative. I don't think it's an exact alternative, because there's some individuals that are going to benefit more from the breast reduction than the liposuction. So I mean, that's clear. You just need to make the decision on what's right for you. And if you question that, get the consultation, and I'll take a look at things and we can make a decision together. Do you have a certain limit of fat you can take out in one time? So it's different in different states. However, in Nevada, the rules they're recommendations. So there's no hard law. There's nothing in writing that says specifically. So it's guidelines and recommendations is what they say, and you can read into that as you like. But it's for us, it's more important not necessarily the volume of fat, but rather the amount of numbing medication that we use. If we use too much of numbing medication, it can become toxic. So in light of that, we try to figure out how big of a procedure we can do, which maximizes the amount of numbing medication in a specific area where we can get out the maximum amount of fat that we want to make the bigger change. Now, this is just the front of the abdomen here. And again, right now we are doing this special is 20% off, and it's 20% off of the treatment of the front of the abdomen. So these are the type of people that we're looking to attract here. These larger individuals that have those big bellies that are hanging over, we can take that away. And today we're offering that at 20% off. And until the end of this month, you have to place the deposit before the end of the month. But we get a lot of fat, that Cuban Tomiac. We get a lot of fat. We're very aggressive. And if you're asking that question, then you're in the right place. You came to the place that you're looking to get a lot of fat taken out. You're probably larger volume, higher BMI, and we can help you. In fact, this special is specifically for you. Okay, I've heard laser lipo heats up the fat as well, which makes the liposuction more effective. Is that true? Carly Vet, that is a sales pitch for doctors, in my opinion. I mean, it might be true, but it sounds like bullshit to me. And I've done thousands of these procedures, and the laser maybe makes it a little bit easier, but it certainly doesn't make it easy. So that's a sales pitch for the doctors, though, and claiming that it makes it easier for them. Whether it does or not, it really doesn't make any difference to you as a patient. I will say that particularly in situations where people have had previous liposuction, the use of the laser is beneficial, because what it does with the scar tissue, it'll burn holes right through the scar tissue, which it kind of creates like a Swiss cheese effect. And then when I take my blunt instruments, I can break through that scar tissue and kind of shred it from the inside out, so we can get better results. So if you've had previous liposuction, it's beneficial for that as well, and it definitely makes it easier. Okay, I had cancer, so my mobility is limited, so I'm having an issue working out. That's the reason for me. All right, Constanza, I mean, we can definitely help you, but I can tell you this, based on my experience and dealing with people, it's rarely, people can lose weight without moving. There's isometric exercises you can do. There's things that you can do if you're motivated, but it's also the diet. Diet is probably like 90% of weight loss is your diet, and you have to figure out what works for you in particular. I know there's a lot of philosophy in eating plans, dietary plans for cancer itself. I've heard a lot of interesting stuff that says that cancer feeds off of sugar, and so if you deprive it of sugar, you can reduce the cancer. I mean, there's lots of really interesting stuff if you want to search and look through these books. There's lots of different studies out there. The crazy thing is that all the information is out there and it's free, but people don't read the books. That's the big secret, is just open the books. The information's there. When you have some of these issues, and this is anything in life, if you're trying to improve any part of your life, any aspect of your life, if you have financial issues, there's literally thousands of books on financial problems. If you have relationship issues, there's literally thousands of books that on relationships. You can become an expert. You can become an expert. That's the way it is in this world that we're in right now. And literally, you can just be like, "Hey Siri," and ask them a question and get the answer just like that. So please read. Please read. Okay, Shanae, how much is the deposit to lock in this deal? The deposit's 25% of your procedure costs. And in order to get the quote on the procedure, you'd get the consultation. Again, up above is the link up in Facebook. And on Instagram, we have the link on the profile up above. Or if neither of those work for you, you can go to our website, myshapelipo.com. There's links there. For this special, you would have to get the expedited consultation because our free consultations are booked out to like February. We're still trying to get caught up on those. But the expedited consultation, we can get you in a lot quicker, and you'll speak to me directly or Kale if he's available. And, we can talk more details and develop a specific plan for you and give you a quote. Okay. Jennifer asks, is massages recommended after lipo? Yeah, they're recommended. We have a great masseuse, Lexi. She's been helping our patients out. She also has a, what do they call it, the recovery house. So, if you decide that you want to stay at a recovery house, that's available. And Lexi's there. She does her treatments or massages, and she's got a bunch of other stuff as well. She helps out with garments. So if that's something that you're interested in, you can take advantage of that. However, if you, even if you do take advantage of that, if you're out of state, then you would need to set something up with your local person. And I always recommend doing that before the procedure. Like, last thing you want to do is have to schedule massages right after your procedure, then find out that they're booked up for weeks or months, so you're not able to get in. All right. What's up, Billy? Lenny? Juanita. Okay. That Cuban says, husband is disabled, can't leave him long periods of time. How long will it take for the procedure to get done, and how quickly can I get back home? I'm currently in Oakland, California. Your husband he needs care, so you can't be away from him too long. Typically for people coming from out of state, the recommendation is to fly in the night before the procedure, so you make sure you show up the day of your procedure on time. And then after the procedure, to stay for about 48 hours. And the 48 hours, the reasoning behind that is afterwards you're going to be swollen, you're going to be draining this fluid, and then draining the fluid, it gets kind of messy. So it's inconvenient traveling when you're draining, when this is happening, it could be inconvenient. So we recommend, waiting 48 hours to travel. It's also safer in regards to blood clots. Blood clots are a higher incidence in the first few days after these type of procedures. So the ability to get up and walk around is beneficial. So again, 48 hours, get back home, and you can help out with him. So I think total it would be about three days, maybe 4 days, depending on how you do. And also you just have to keep in mind that everyone's different. Everyone's different. So when I'm telling you these estimates, they're just estimates, and for you it might be longer. So you just have to take things into account. And again, just realizing that these things are possible, and being prepared for them. everybody gets all anxious and nervous, and if you would just spend more effort and time and energy into preparation, you wouldn't be worried all the time. At least that's worked for me. Focus that energy on what can you do instead of, oh my God, this is going to happen. Okay, what can I do in case that happens, or what can I do to reduce the chances for this to happen? We already know that there's that people are going to be swollen after these procedures, that they're going to be bruised, that they're going to be draining fluid. We already know that you have a bunch of wounds, with the incision points, and those are going to be the potential for infection. So you just have to prepare and be ready, and in case shit happens, then you have to implement the plan. And that's what we've done. And we've tried to make it easy for people. And the advantage is that you don't have to plan out all the details, but in case shit happens, we're here for you. So you get our phone number, and we connect with you. You can text, you can send, whatever you need. We're here to help and guide and help you along this path. Okay. Yeah, I wouldn't. Let's see, beautiful, quiet storm. I wouldn't leave the next day. There's people that do that. It's just, I've heard bad stories of people that try to leave too quickly, and they're in a rush. You got to take care of your body, take care of yourself. This is traumatic to the body, so you never really know how your body's going to react to it. So you could feel like crap after the procedure, nauseous, lightheaded, dizzy. That can happen. It's not like it's really common, but it happens. It's rarely we have to keep people longer periods of time, help them with nausea. We have anti-nausea medication. We can do IVs if we need to. Very rare, but it's possible. We're there to help you. Whatever you guys need. And we're not trying to do these procedures and kick people out. We'll help you out however long you need. So Jennifer says, is the lab exam needed prior? Yeah, so we have our basic lab tests that we do prior to the procedure, and it's really easy. There's a lab that we deal with where we can order them online, and they'll send you an email with the order form. So all you have to do is click a button, find a location near you, and they're affiliated with a couple different labs, like LabCorp, which is they're like everywhere. They're everywhere. So it's more than likely you're gonna have a place within like 10 minutes from you. And to go get the labs, it's you just set an appointment. You go in there. It takes it doesn't take that long, but to get in with the appointment, maybe I plan about an hour, and that's it. You get the labs, and then we review them. We review your medical history, then you get cleared. Most people, if you're healthy, it's not that big of a deal. And you guys can, take some ease in knowing Kale is emergency medicine trained, and he sees all kinds of crazy stuff in the ER, and he's there in case shit happens, kind of thing. So again, we try to be prepared whenever we can, and unfortunately, in preparation, many of the bad things don't happen. We do a lot of things to avoid problems, and since we've done this so long, I know what the problems are, and I know what to anticipate and what to expect. And then when we do have problems, we know how to treat them. We know how to solve them. We know how to mitigate and make them not as bad for you. That's the ideal. If taking any vitamins, do we need to stop taking them before, and how long? So vitamins are typically not an issue. Most of them don't have any side effects. However, some of them are deemed as blood thinners. I think like vitamin E might be blood thinner, or what is it? The fish oils, those might be blood thinners. We'd have to look into it. We have a list of that stuff. But in most cases, you don't need to stop. Worst case scenario with any of these things, stopping a day or two before the procedure, a week at most, it would be beneficial. But really the big concern would be is if any of them are blood thinners by nature. Okay, what would be a reason for the results not getting the surgery? Reina, what does this mean? Okay, what would a raison? I don't know what you're asking, Reina. Sorry. Okay, hi, I paid for a consultation and didn't receive a call. Is there an email I should write or should I call the office? Call the office, and that's me, unfortunately. So it's no one else's fault but myself. If you do the paid consultation, that's me not following up, so I apologize. I'm kind of busy, and I know that we schedule times on there, but I don't like to stick to a clock. I'm a business owner, and I show up and I do things as quick as I can. So typically, when I'm ready to work in the morning, I'll make all of my phone calls, and that might be around 10 in the morning or noon is usually when I'm doing it. So I apologize, Tiffany, if I missed you. Call the office and let them know. Sometimes there's like cracks that people slide through and we miss them. We're working to figure that stuff out right now, because there's a couple people in the past I think we may have somehow missed. So please call. We'll take care of it like tomorrow. Pretty quick. Okay. Yeah. Well, don't worry. We'll get you. And like I live my life. I don't like live in a rush. I'm always I'm an efficiency freak. I like to do things efficiently. So a lot of times when they get these scheduled consultations, they'll be like one at 10, one at 12. One at 11, one at 1, and like we'll have them all over the day, and I can't stand. I don't want to sit there all day and then have these big gaps in times because I got a lot of other things that I can do. So I'll typically just knock that stuff out. So I apologize if if you're like really time conscious and you have to have a specific time. But if that's the case, we'll just reschedule and figure out a time that works out for you. Let's see, you're saying what area code we'd be calling from? It should be 702. Okay, the blood test that we get done, what would be the reason for you to not do the surgery? Okay, I see. So the blood tests, it's typically the reasons why would be if you have an infection, an active infection. So if your white blood cell counts are elevated, and there's something going on in your system with an infection, then we would postpone. If you were diabetic and your hemoglobin A1C is elevated and your sugars are out of control, that's a reason to postpone. And again, as you're hearing, I'm not saying cancel, I'm saying postpone with both of these. So if there's an infection, we treat the infection and then do the procedure. If you're diabetic and your sugars are out of control, we get the sugars under control and we do the procedure. Clearly there's going to be some other blood disorder type stuff that is bigger concerns, but we don't typically see a lot of the bigger concerns. So those are the more common things. Yeah, you won't miss it, Tiffany. And again, like I said, I'm really responsive. So if they just tell me what day and time, like I'm one of those things that you just tell me go and I do, and then it's done before you even know it. So we'll take care of you. Don't worry. Abston, can't wait until I get my 360. My other surgery on my inner thighs was a success. I'm thinking February. Awesome. Anytime's a good time, So it's whenever it makes sense to your life. There's no right answer with any of this stuff. I have people that want me to put together some like detailed plan on how to make it right for them, and the truth is like the right time is whenever. The right time is now, because if you put it off till later, and then you'll end up putting it off and keep putting it off. So I think that a lot of people have told me in the past that when I give these incentives like this, it allowed them to finally just make the decision to just get off the bench and play, because you're never going to get the results if you don't actually try to get the results. Um, I had this quote the other day. It said, "You're never going to learn from the books that you don't read." And it just made me realize that we're never going to gain the experience in life unless we get out there and take risks and push the limits. If you keep doing the same things that you've always done, you're going to keep getting the same results. So if you want to change your life, you want to change the lifestyle, you want to have a different outcome on your life, then you have to start changing something. And if you don't change something, then nothing will change. I mean, it sounds like obscenely simple, right? If you don't change something, then nothing will change. I mean, it's obscenely simple. However, there's people that go about their life thinking that they're going to lose weight or they're going to do something just without changing anything, or they make a short-term tweak like, oh, I'll stop drinking soda for a week, or I'll stop drinking alcohol, or I'll go vegetarian for a month, or I'll try this other fad diet. Like, if you try to do something for a short period of time and then go back to the same old stuff, you're just gonna go back to the same problems, because the problems are created by the activities that you do, the habits that you have, the things that you do on a daily basis. That's how the problems came about. And once you realize that how the problem started, you can start to address and change the base, the foundation, where it starts. And it's typically people. It'll be your mentality, your mindset. What do you believe? Do you believe that eating food is an activity, something that you're doing for fun or entertainment, or is it like when you go to a city, are you a foodie where you have to go to these restaurants and spend a ton of money on the food? In those cases, eating food is like a sport. It's not for sustenance anymore. It's a sport. And when you're eating when you're not hungry just because you think that you have to eat, then if you don't know your body enough, then you can't do what's right for your body. And the only way to know your body is to try different things and test your own limits. Like, I've pushed my limits so far in so many different directions that I know what I'm capable of doing. I've mastered my body. And if you can't say that about yourself, then you have to start working on it. And read books. Like I said, I'm going to say it over and over and over. Read books. There's answers out there. You just have to find them. And everybody's so different that one thing isn't going to work for everybody. So you have to do many different things and see what works for you. And sometimes what happens is something works for you and then it doesn't. Okay, move on. Do something different. Some of you, you've tried all kinds of different things and you've struggled and you need help. Liposuction is that extra push, that kick in the pants, that push forward, that help that you need to get the results that you're looking for. And if we can help you out with that, sometimes it's the catalyst. So if you remember back in chemistry, there's like that one chemical that sparks the reaction. So liposuction can be that catalyst to where, in addition to your lifestyle changes, liposuction can push you over that limit and get you to the point where you feel good about yourself and you have that confidence level and you feel like you can keep pushing beyond. That's where we need to get to, that point where you're happy with the results, to the point where you don't want to undo. See, when you get far enough, you're like, I have to keep going because I don't want to go backwards. And sometimes you might slide a little bit, but then it's just it propels you forward. It's like the rubber band effect. You might pull back a little bit, but you gotta fling forward. Okay, let's see. Are you doing any promos for arms? Not currently. Right now is a deal for the big bellies. We're trying to get rid of big bellies, help some people. can we do arms and belly lipo at the same time? It might be possible, just depends on your size. Typically though, when we do the arms, we are also addressing the underarm here, which we call the front brow roll, and the upper back area here, which we call the back brow roll. So in general, I like to break the body down into different procedures. So I'd be like the upper third. So in this case here, you see that the arms, the front brow roll, and the back brow roll. So the upper body, the chin would be involved in the upper body as well. I like to bulk these all together because we're working in all the same area. And I like to solve a problem first before jumping around to a different area. I find the people that try to do and solve multiple problems, it's like you're like spreading yourself too thin. You got to just focus and get isolate and get the best possible results on one problem, and then move on to the next one. But theoretically it's possible. We can work out a plan for you if that's something that you want to do. My consultation is Monday. I'm coming no matter what. Awesome. That's what I'm talking about. I like to deal with people that are just hardcore. They're looking to get results, and they're willing to do whatever is necessary. And they mold their life around this to make it happen. I'm the type of person that when I get an idea, I change everything to manifest whatever dream I come up with. And when I do that, I feel like it's like setting an example for all those people around me, and I attract more people that are just like me. So I know that by me even just saying a lot of these words, I attract people that they make sense to, and this is where the law of attraction comes in. The other day I was speaking, and this has been happening more and more often lately, where the individuals that come for procedures, they say that they felt like I was speaking directly to them, and this is how when we talk about law of attraction, the law of attraction is essentially we're putting out the energy into the world, and people are attracted to that energy that have similar like energy. So when I speak about these things that I speak about, the people that are thinking in the same thought process, the ones that are right at that range where we're on the same wavelength, we're at the same point where I've caught you to where you're ready to transform your life. And when you're ready to transform your life, you hear what I'm saying. You really hear it, and it hits home, because this is your time. If you really want to change your life, this is your time. And nobody else is going to do it for you. You have to take the steps. We can show you the path all day long. We can show you thousands of pictures, tell you all these stories and journeys, but you have to leap. You have to take that jump and just do. And stop being scared. It's that fear that stops people. And I'll tell you what, people will wait years until they finally make the decision, and that's the wrong decision. You should not waste years of your life. If you're going to get it quickly, and just get it done, because this is the beginning of the rest of your life. And it's once you have the confidence from getting this procedure, it affects every aspect of your life. And so if you're looking to live a better life, you just have to keep getting better and doing better. And what does that mean? I don't know what your issues are, what you believe you can improve, but just keep improving. Like I'm personally trying to improve everything. I want to improve my relationships. I want to improve my health. I want to be in better shape. I want to be stronger. I want to be more flexible. I take care of my skin to make sure my skin is good. I'm getting older. I'm getting wrinkles and stuff. So I don't like that stuff. So I'm doing everything I can to improve myself. And I've gotten on the path of longevity. I'm trying to live to be, 150. I put goals, right? So I kick my goal way out there. And I believe that if I got big goals, my mind will start figuring out solutions of how to reach those big goals. And so that's why, when I talk to my mom, she's like, oh, well, I think I'll live to be, like in my 90s. I'm like, that's average. I'm not an average person. I don't want to meet where everyone else is. I want to far exceed. I want to go so far beyond. People are like, holy shit, what's this guy doing? And to me, that's where the inspiration is. That's where the motivation is. When people see somebody reaching for the stars, and then they see them like just skyrocket past them, They're like, holy crap, what's that guy doing? And you know what? If he can go that fast past me, maybe I can do more. Maybe I can do better. And that's what I'm hoping. I'm hoping that I can be a positive example for all of you. And I'm willing to put in the time. I'm willing to put in the effort. And if you want to have people around you that are doing the same thing, get into the group, into our private Facebook group, and join the club where all these people are trying to do the same thing. When you have people around you that are supporting you and they're reaching for the same stars and trying to achieve the same goals, trying to live the best life, when you're surrounding yourself by people like that, that's when this magical thing happens. Your whole life starts to change. So I'm getting tired here. I got a soccer game to go to tonight. So thank you so much for watching, and don't forget, the next step, if you want to take advantage of this 20% off, is to get your consultation. Click on the link, get the paid consultation. The $100 fee comes off your procedure cost, so it ends up being free as long as you get your procedure. Next step, get your consultation. I will be back here talking maybe Friday. If you guys have any questions, you can jump in then. Now, real quick, why does this clinic have such bad reviews? You know, when you have 15,000 procedures, you know, there's people that leave reviews, and it might not even be actual patients. In many cases, it's not. And I got tired of looking at bullshit that was fake, so I stopped paying attention to that stuff. That's why we created our private Facebook group where we have actual real patients where you can connect with directly, not these fake review sites. So if you want real stuff, go talk to the real patients on our private Facebook group, connect with them. You can, you know, get on with them privately so you can get the real information. So thank you very much for watching. I hope that answered your question. You guys have a fantastic day, and we'll see you on Friday.